Are you preparing for Pharmacology Viva? Let me tell you a few terminologies of pharmacology that can be asked in the Viva. Bronco Dilation. It is defined as the airways dilation in the lungs due to the relaxation of smooth muscles. So which drug can cause bronchodilation? You need to make a guess. It can be albuterol. Causes sympathomimetic activity by binding to beta-2 adrenergic receptors. Inotropy. Condition in which force of contraction of the heart changes. Increased force of contraction of the heart is positive inotropy and vice versa. So which drug causes positive inotropy? Digoxin. It causes inhibition of sodium-potassium ATPase enzyme. Chronotropy. Condition in which the speed of the contraction of the heart changes. Increased speed of contraction of the heart is positive chronotropy and vice versa. So which drug causes positive chronotropy? It is epinephrine. It causes sympathomimetic activity via binding to beta-1 adrenergic receptors. Hyperglycemia. It is a condition in which the blood glucose level increases. And which drug causes hyperglycemia? It's salbutamol. It causes parasympathomimetic activity by binding to beta-2 adrenergic receptors. Lipolysis. Condition in which fatty acids are break down by hydrolysis. So which drug causes lipolysis? It's nebivolol. It causes lipolysis via binding to beta-3 adrenergic receptors. Pheocytochroma. A small tumor of the adrenal medulla causing irregular secretion of epinephrine and norepinephrine. So, which drug treats pheocytochroma? It's a tricky one, and it's phenoxybenzaimine. It causes inhibition of adrenaline by blocking beta-1 adrenergic receptors. Subscribe for more such lectures.